Almost every woman undergoing fertility treatment today ask about exercise and how that may affect her fertility. I think we know that exercise is a good thing. I think it's a little bit difficult with the studies today to exactly know how much exercise is good and when you have too much exercise affecting your chances of getting pregnant. I think a lot of that has to depend on what a woman's conditioning is before she attempts pregnancy. You know, obviously women that are at the gym or running 2 or 3 times a week, that's a little different than somebody that's training for an hour every day. We generally recommend the amount of exercise. 4 to 5 days a week is fine. I think you need at least 2 days of rest. I think how strenuous exercise is also has an effect. Generally, the recommendation is during pregnancy to keep a pulse rate under 130 per minute. And I think that's a good goal prior to pregnancy. I think by spreading the exercise interval out to maybe an hour and 15 minutes with more duration and less severity of the program is an important thing. We know that also important in exercise is becoming not dehydrated. Good fluid intake is very important because that may have adverse effects on just your general body health and physiology. But most women that have had a training program, and particularly women that run or spin daily, really want to maintain that exercise program. And I think that's probably okay. I think when we do in vitro fertilization, we have to recommend that women decrease any high impact exercise in that last week of the treatment for in vitro fertilization because the ovary is enlarged with follicles and it may undergo some twisting or torsion, and we don't want to have that as a complication. But also women get very uncomfortable late in the afternoon from that kind of gravity effect of the increased weight of the ovary late in the stimulation process for IVF. So the doctor will help to guide you through that as you go into an IVF cycle. But again, I think the important thing is exercise is good for getting pregnant. Getting the body toned in anticipation of carrying a pregnancy is very important. Along with the corollary of exercise is good nutrition. We send many of our patients for consultation with a nutritionist to develop a good balanced diet. I don't think anyone's identified any particular fruit or vegetable or any vitamin intake that particularly increases one's fertility. But I think exercise is probably more important than any vitamin that you can take.